Unlock the future of pathology with Pathology News, your ultimate source for cutting-edge insights, expert analysis, and the latest breakthroughs in digital and computational pathology. Don't just stay informed, stay ahead.
Hello and welcome to Pathology News. Today we're joined by Bryce Brown, who's the Director of Product Enablement at Leica Biosystems. And today we're going to be discussing the recent partnership between Leica Biosystems and Diadeep. This is quite big news, but not the first partnership that we've seen recently. Bryce, welcome to Pathology News.
Thank you for having me. It is an exciting time in pathology, and I'm glad to be here to talk about it.
Yeah, absolutely. And great to have you on. I wanted to start specifically with Diadeep. Now, there's so many AI tools out there. Some are geared towards diagnostic image analysis. Others look to automate different parts of the pathology workflow. But what about Diadeep? Could you tell us a little bit more about it? What do the Diadeep tools offer pathologists?
It's a great question because Diadeep is a bit different. Their tools are specifically really focused on some of the most challenging and time-consuming areas within digital pathology, and that is biomarker quantification. They've got a suite called DiaQuant, and that suite automates the scoring and quantification of those key biomarkers like PD-L1, HER2, Ki67, ER and PR. And what really sets them apart, honestly, is that they were founded by over 40 pathologists and oncologists. So these tools are really genuinely built from the pathologist perspective, designed to act really as a co-pilot, right? Rather than looking to replace them for what they're doing on their day-to-day workflows.
Yeah, fantastic. Thank you. And as per the partnership with Diadeep, I believe those tools are now part of the Aperio AI Store. I'm just wondering, why was it important for the Leica Biosystems Aperio AI Store to include these new tools?
Yeah, so great question. Really kind of based on really the Diadeep expertise, right? It broadens the depth of our oncology offering within the AI Store, specifically around that biomarker quantification. So PL1 and HER2 are some of the most common yet variable tasks that pathologists face every day. And so that variability in PDL1 scoring, for example, it's a well-documented challenge. And that variability itself can impact treatment decisions for cancer patients. And by adding the Diadeep biomarker quantification algorithms into the AI Store, we're really giving pathologists access to more tools that address those real everyday workflow pain points.
So, what about those current Diadeep users? Are they still going to be able to use the algorithms as normal, or is it something they'll have to access through the Aperio AI Store?
Yeah, so for existing users, it's really about expanding access and simplifying the procurement of those algorithms. With the Leica Biosystems serving as the reseller, labs can access Diadeep's algorithms through that same trusted channel that they're already using for digital pathology, right? Whether it's the scanners, the software, the service they're getting from Aperio and Leica Biosystems, having it through the Leica Biosystems as a reseller really removes that friction of having to identify, evaluate, contract with separate AI vendors independently. You get a single relationship and a unified platform that is really streamlined the path to deploying those tools. For labs that are already using the Halo AP, Diadeep's algorithms really become accessible right there in the AI Store, embedded directly in the workflow they know. So the short answer is that it makes things easier and more accessible and not more complicated. So all good, I think.
Oh, thank you, Bryce. And I'd love to hear more about this Aperio AI Store. Could you tell us a little bit more about it?
Yes, of course. So the Aperio AI Store is our curated open concept marketplace for AI-powered digital pathology applications. And it is exclusively available through the Aperio Halo AP IMS, which is our IMS that we've developed in partnership with Indica Labs. And so think of it as a single storefront where pathologists can discover, compare, deploy advanced AI tools from multiple providers, all within a single user interface. It was originally launched in October 2025 at PathVisions, I believe September DCP, and the momentum has been remarkable. So the ecosystem includes today partners like we've got Indica, Lunit, DeepBio, Histify, MindPeak, and now Diadeep. So each bringing that specialized capability across those areas of biomarker quantification. quantification, patient analysis, IC scoring, prognostics, and even more, right? So what makes the AI Store unique is that it is curated, multi-vendor design. So we're not looking to build every algorithm ourselves, right? Instead, build the platform, build the infrastructure that lets the best AI innovators in pathology deliver their solutions directly to the pathologists, really seamlessly embedded in one workflow. And it's really about giving labs choice, right? Reducing complexity, ultimately making computational pathology practical and scalable for everyday use.
Oh, great. Yeah. And, having all of this in one place is fantastic. And you mentioned some really big algorithm companies there. So it's great to see that people have access to all of those algorithms in just one place. Thinking about licensing then, and I'm just thinking about the price point for the pathologist here. How does licensing work? Is it a yearly license and you get access to all of these algorithms, or is it more kind of pay as you go for the algorithms that you use?
Very great question and a super important answer, because the way that the AI store was designed is it's designed to be flexible. So the store operates on a model where labs can select and license specific algorithm just that they want for that day or their needs for that moment, right? And you're not locked into an all or nothing bundle with algorithms that you're not going to use. And that flexibility was intentional. We want labs to be able to start with their most relevant needs at the time and then expand as their needs evolve. And so ultimately, it's really a scalable toolbox, and rather than a one size fits all subscription.
How will this integrate with other image management systems? Will these tools be exclusives on Aperio AI Store now, or will it be open to other IMSs?
So the AI store is only available through Halo AP, and that was deliberate and designed by choice. So that the importance of that deep integration between the store and Halo AP is what enables the seamless embedded experience that makes AI adoption practical, right? The algorithms run within the same interface that pathologists use for slide review, case management, conferencing, collaboration. There's really no context switching or workflow disruptions. And that said, I should note that individual partners like Diadeep, for example, they may wish to offer their solutions through other channels and platforms independently. That is totally up to them as innovators in this space. But the unique value of the AI store is that depth of integration that it brings with the full digital pathology ecosystem. It's that end-to-end workflow integration that truly unlocks computational pathology.
Just thinking forward as well, then, this isn't the only partnership that we've seen from Leica Biosystems recently. In Jan 2025, we've of course witnessed the Indica Labs partnership, which was again pretty big news. Do you think we'll see further partnerships between Leica Biosystems and more AI companies in this space as we move on?
So without getting into any specifics, I think the trajectory that we've been going on has been made that sort of answer pretty clear. We originally launched with Indica Labs, Lunit, Histify, DeepIO. They were the first ones in. We've subsequently added MindPeak in early of this year, and now most recently, Diadeep. So that pace of growth reflects both the demand from the market and our commitment to building an open, best-in-class ecosystem. So yes, I would expect the AI store to continue expanding. We're actively engaged with AI companies across the globe and focused on, again, curating partners whose solutions address real clinical needs and research needs. And the goal is to make the AI store the most comprehensive and practical destination for AI and digital pathology.
Bryce, you lead product enablement at Leica Biosystems. What do you personally see as being the most important thing for the pathologist over the next few years? We're getting into grounds of using a lot of AI now. I'm really intrigued to hear your point of view on this.
So, in my perspective, is that I think the single most important thing is making AI practical and accessible and moving it out of that proof of concept stage into routine everyday use. As we all know, pathologists are facing unprecedented pressures, through growing case volumes, increasing biomarker complexity. We see that with the PD-L1, right? Workforce shortages and demand for faster and more precise results. So it's the promise of AI in pathology has been talked about for years, but what pathologists actually need are solutions that work within their existing workflows, and they're validated, they're easy to deploy, they're genuinely saving them time on the tasks that are the most repetitive and variable. So they need tools, again, to act as a co-pilot, really augmenting their expertise and not adding to this additional burden.
Great, thank you. And we've talked about the Aperio AI Store here, but how else is Leica Biosystems supporting that vision of the future?
Yeah, so I think we're supporting it on multiple fronts, really. So first, of course, through the expansion of the AI Store we talked about before, right? Bringing in more best-in-class AI partners and tools to the pathologists through that single integrated platform. That is one. And secondly, deeply integrating that into the full Aperio digital pathology suite, right? So from high throughput scanning associated with our GT450 and the GT Elite, through to the IMS and the AI analysis that's available now within the Aperio Halo AP and the AI Store. So we're focused on delivering an end-to-end computational pathology workflow that removes the barriers to adoption. That would be two. And then thirdly, and this is really where my role in enablement comes in, we're investing heavily in making sure that when labs adopt these tools, they're supported every step of the way. And that means education, training, hands-on support to help pathologists and lab teams integrate that AI into their practice confidently. And ultimately, through those partnerships, not just with AI companies, but expanding even into pharma, right? The AI Store provides a platform where pharma companies can develop and deploy tools for companion diagnostics and accelerating that path from biomarker discovery through to patient treatment. And so that's really about building the complete infrastructure, hardware, software, the ecosystem, and then ultimately enablement. That's the vision, and that's what we're executing on every day.
Great. And I'm so glad that Leica Biosystems has a foothold in that whole cycle, really. Bryce, thank you so much for coming on today. I think that's a wrap for us. It was really interesting getting an insight into Diadeep and the biosystems and the depth that this Aperio AI Store really has to it. Thanks for joining us today. I hope the audience have enjoyed this as much as we have, or I have certainly. Thank you, Bryce, and we'll catch everyone on the next one.
Absolutely. It's been a pleasure. Exciting times ahead in digital pathology, and we are excited to be part of it. And thank you again for the time today.
Yeah, very welcome. Thanks.